Polly, who's Director of Employee Benefit Consulting and Onsite Clinic Consulting for CBIZ, is at the forefront of all of these changes, knowing what's happening, advising your clients on it. Polly, thank you so much for joining us.
Thanks for having me.
I wonder if you could share, as a starting point for our audience, just a little bit about CBIZ and its play in employee benefit consultings and especially around on-site clinics and, how you're advising clients on those issues.
Sure, absolutely. So CBIZ is an employee benefits consulting firm, and we actually have a practice dedicated to helping clients evaluate whether or not it makes financial or other sense to incorporate an on-site clinic as part of their total rewards strategy. So we have a team of individuals, clinical and financial analysts, that really dig into claims data and help employers understand what scope of services they might want to offer, what type of partner they may choose to deliver and provide the services, and then, a recommended staffing model as well.
Are there certain industries or types of businesses that are sort of more favorably inclined or more appropriate for on-site clinics than others?
That's a great question. And, in the early history or more recent history of on-site clinics, these, started out as more centers to treat work-related injuries, and by nature that lent itself more to manufacturing companies and organizations. But in the past 5 years, we've really seen that isn't the case. There is not a specific industry. We see clients in the public sector, we see clients in the private sector, we see manufacturing, we see high-level professional organizations like law firms and architecture firms. So really there's no, niche industry, which I think is a common, misperception, primarily because, when clinics started out, they really were more work-related injury treatment centers.
Well, I want to come back to, thank you, and I want to come back to the type of type of employers who might be appropriate for this and talk about size of company. But first, can you help us quantify the size of growth and the pace of growth in this field? I mean, are we hitting an inflection point here with on-site clinics?
Absolutely. I mean, there are a number of different surveys that have been done of employers, and, the respondents of that indicate that, anywhere from 30 to 50% of employers with over 500 employees either have an on-site clinic currently of some sort or are evaluating and considering implementing this type of a solution. And we have certainly seen our project activity increase by about 40% over the past 3 years.
Wow. What's driving this?
I think it's a number of factors. One, with the passage of the Affordable Care Act, employers are understanding that it is their job and a financial necessity for them to control the, increasing healthcare cost. And so they're getting much more serious and rigorous about the approaches they're taking to do that. And this is certainly a way that has now been well proven in terms of the return on investment that can exist. And then I think the other reason is that, in certain regions of the country, we are dealing with some primary care access issues as employers have educated their employees on how to be good stewards of their health care. They've, continued to talk to them and help them understand the value of having a patient-centered medical home or a primary care relationship. And that in some regions is causing some capacity and access issues. And so, some employers, if not for financial reasons, are really looking to help solve that access challenge.
When you say some regions, what are you talking about? Rural areas, or what do you mean by that? And what are the regions?
Yeah, so certain geographic areas of the country. So Wisconsin is a great example where, there are a limited number of primary care physicians, internal medicine physicians, and so, we're seeing that this becomes a very viable solution when there's long wait times to get in to see a new physician. We're also seeing that in some of the busier cities, San Francisco, San Jose, New York.
Great. Interesting. Well, so shared clinics are on the rise, and they seem to offer smaller employers the opportunity to provide their employees with care they wouldn't be able to access otherwise. Can you speak a little bit more about that?
Sure. So, this has become a great solution, whereas, historically you needed to have roughly 1,000 employee lives or members to cost justify this type of solution. There are now some organizations that are partnering together that might be smaller in nature. So as an example, we have a client that a city, a school district, and a county came together and formed a shared clinic, which allowed their clinic to be open much longer than they would otherwise be able to, but it also allowed the city to participate in this type of a solution when, if just on their own with 400 employees, it would not have been feasible or viable for them. And we're also seeing some national on-site clinic vendors that are even building, and providing the bricks and mortar, for lack of a better word, and then allowing smaller employers through a monthly membership fee the ability to participate. And so, really any size employer would be able to participate in that type of a solution.
And has telehealth come into play in any kind of direct or hybrid, sort of hybrid bricks and mortar and online model? How does that fit in? How does that fit into the mix?
It has. We're seeing an increase really within probably the past 6 to 12 months is where we're really starting to see more of the national vendors provide a telehealth solution in addition to the on-site clinic options that exist or their core services. And then we're also seeing even some mobile health. So as an example, here in Kansas City, there's a health system that has a mobile van that has exam rooms that on the inside look exactly like a physician office exam room would, and it can drive to different employers and provide physicals or other services.
Is there a special section on that vehicle that makes where you can wait for an inordinate amount of time? Is that with magazines that are 5 months old?
There is not.
Oh, I'm sorry. Did I say that out loud? Yeah. No, I'm sorry. I didn't mean to make fun of, because that's I love that idea, and it's a strong one. So it's interesting to see how those will play. And then there's this notion of Nearsite clinics. Can you say a little bit more about Nearsite clinics? Is that just for the nearsighted?
It is not.
I'm sorry, we're punchy. It's Friday.
It is. So Nearsite clinics are the idea that an employer could sponsor a clinic, but they're a great option for employers who maybe don't have extra space where they could build out a clinic, or they simply don't want to go through the cost and expense of retrofitting an existing space. So we have a number of clients over the past year that instead of having it on their campus or on their work site, they've leased space, sometimes in an existing physician office building, for their sponsored health clinic. And that has worked well for a number of reasons. One, sometimes the cost is much less, because if you can find a building that was originally designed to provide medical care, your renovation expense is much lower. But we've also found that for some employers, it's a way to get better adoption and utilization for dependents who maybe don't live near the work site. And so, really understanding the geographic demographics and makeup of the population can help an employer decide, if a Nearsite option might be better off. And then the other thing that we have found that a Nearsite arrangement helps with is occasionally in these type of solutions, employees may worry or have concerns about the security of their information and the privacy if it's located at the employer's site. And so a Nearsite clinic can be a way to provide a little bit more separation. The reality is HIPAA laws still apply whether the care is sponsored by the employer or provided in a community-based physician practice, but educating employees about that, is critical to the success of this type of an initiative.
Right. So I want to get back to privacy and security in a minute, but I wonder about the kinds of treatments that are being provided in these clinics, and do they extend to mental or behavioral health?
Sure, that's a great question. We, in nearly every group that we have an opportunity to study data on, mental health is a serious concern and challenge, and we are seeing more and more of these solutions offer some sort of behavioral health component, whether that be through dispensing behavioral health medications or collaborating with an existing EAP and having that EAP provider on site periodically. The other end of the spectrum would be actually employing a behavioral health specialist or counselor that's there as part of the core clinic staff. And we've really seen services evolve over time. So it used to be, these started out as occupational health centers that evolved to treating more acute, issues, colds, flus, sinus infections. And now we've really seen that more employers are focusing on full service primary care, preventive health, and then supplemental services like chiropractic, physical therapy, health coaches or wellness coordinators that are staffed in the clinic that can really help employees and dependents manage more chronic issues that ultimately lead to the greatest cost savings.
So we were talking a minute ago about privacy, security, and it just sort of brings up the umbrella issue of where regulation intersects with on-site clinics. Everything from the ACA, the Cadillac tax, to HIPAA, and so on. Can you just share your thoughts and advice on what employers and others need to be aware of with regard to, the regulations out in the market, and if you're thinking about an on-site clinic, what you need to pay most attention to from that perspective?
Sure. So, there are a number of things, and I'm sure you'll find this shocking, but the laws in some cases contradict each other in terms of how they're pertained to on-site clinics. I know we've never seen that happen. So it's important that, our guidance is always to consult your ERISA attorney if you're thinking about this type of an offering so that you understand, because based on the scope of services that an employer offers, certain laws and regulations apply. So as an example, we already talked about HIPAA a little bit earlier in terms of security, but on-site clinics are considered accepted benefits by HIPAA. However, if you're providing anything more than de minimis care, which is basically first aid care, which really any of the employers that we're working with are providing more than just de minimis care, then you are subject through the Affordable Care Act to the Cadillac tax or the excise tax. Now, what's interesting about that is we're still awaiting guidance on specifically how that should be calculated. So, keep your ears open and, be in close touch with your ERISA attorney to understand that and what that's going to look like down the road. The reality is, a lot of employers that we work with are asking, well, does that mean then that this is not a viable solution? And for all of the customers that we have that have on-site clinics today, their trend has dramatically slowed. And so, most people are going to end up triggering the Cadillac tax at some point or another. this becomes a potential strategy, if done correctly and thoughtfully, that can slow the rate at which that trigger happens. And then the other thing from a compliance standpoint that's really important to think about that a lot of times is missed is the need to have a plan document. And an on-site health clinic technically is an ERISA plan. So really having and making sure that your plan document incorporates the services that are provided and the eligibility just like you would for any other benefits.
Mm-hmm. Wow. Well, I'm pretty sure I could keep you talking for a long time. It's fascinating, and you're clearly expert in this area. Very much appreciate your taking the time to be with us. Before we go, though, can you maybe sum up and share with our audience a few takeaways that you want to make sure they remember or think about?
Sure. I think the first is do the due diligence on the front end if you're considering this, and be thoughtful about the staffing model that you think is going to be most impactful. We're seeing many more physician-staffed clinics as opposed to mid-level staffed clinics, or even hybrid, a combination of mid-level providers and physicians, which allows for a more expansive scope of services. So, be mindful and think about that. And then the other is just the idea that there's really no specific size that this makes sense for. So even smaller employers can investigate and think about this in a shared capacity.
Great. Well, if our listeners want to contact you or learn more about this, what's the best way to do that?
Sure. So there's information on our website, which is at cbiz.com. And then my email address is pthomas@cbiz.com. And that is a great and easy way to reach out to me.
Great. And Forum West, IHC Forum West. Did I mention that yet today? No, Polly's going to be speaking there, and we look forward to that. Polly, thank you so much for joining us today.